Today, we've given you some great solutions for serious issues affecting your health. And now we have a new option. It's for women seeking a more permanent solution when it comes to birth control. Could it be right for you?
35-year-old Amanda Bellina had a tough time delivering her two girls.
2 previous abdominal surgeries that were major, and then on top of that, each of my children were C-sections. So that created further scar tissue.
Her doctor told her she should not have any more kids, so she wanted a permanent solution.
Knowing that I can't get pregnant no matter what happens was the most important factor.
Instead of having surgery to have her tubes tied, she chose the new FDA-approved procedure called the Adiana system. There are no incisions or cuts. It requires only local anesthesia and is done in minutes. An instrument delivers low-level radiofrequency energy to each fallopian tube. A tiny insert about the size of a grain of rice is then placed in each tube.
We place this little spongy material inside. We kind of drop it there. Then the body forms scar tissue around this spongy material and just seals everything shut.
Dr. Lisa, why don't you explain this?
This is very effective, but and you have to do a hysteroscopic procedure to place this in, and some doctors do that in their office, or they do it as an outpatient surgical procedure.
What is hysteroscopic?
Basically, what it means is you use a catheter, you dilate the cervix, you put the catheter through the cervix into the uterus, and then these coils are placed into the fallopian tubes with a radio frequency actually inserted as well. So the catheter, again, goes through the cervix into the uterus, and it is used to place the coils into the fallopian tube, and scar tissue is going to form around that. But then what you have to do is about 3 months later, you have to instill dye to make sure that the tubes have actually closed, and so that the sperm still can't break through and cause pregnancy. So you do have to prove that this is actually working, sort of like you have to prove with a vasectomy.
But how can you prove it with dye? Because dye doesn't have little tails that swim.
Yeah, dye doesn't swim.
Like the
Especially
sperm.
if you have
No,
really
what you do
sperm.
is you check that in the animation. It's just really what you do is you put dye in to make sure the dye doesn't spill out of the tube. That shows the occlusion. And if it's occluded, then
Or
the
if
sperm
you
can't
could
get
just,
through.
if a baby starts growing, then you know it didn't work.
Well, that can be one of the downsides with it is the scarring around it can actually, if it doesn't work, sometimes it can increase a woman's risk of ectopic pregnancy or pregnancy in the tube. So your doctors do need to speak to you about that. I mean, it's great that we have more and more options, especially for women who've had surgery, really trying to avoid major surgical procedures, and their partners won't get that vasectomies. Then this is another good option.
So talk to your doctor.